Good morning, everyone. It's nearly good afternoon, isn't it? No, it's still morning. Thank you very much, Oliver, for that kind invitation. And I'm delighted to be here today to, I suppose, tell you a little bit about Arthritis Ireland and the work we do. And I suppose in relation to maybe some of the things that were put forward so far this morning, this concept of making every contact count. I would like to invite all of you to make every contact count, and I suppose I'd like you to ask yourself, I'm not going to ask for show of hands, but I'd like to, those of you that are working directly with people with arthritis, when you meet a patient or a new patient for the first time, do you ever tell them that there's a patient organisation out there that can support them? So I see some people nodding, and I recognise some of the faces in the audience, so I suppose I'm probably preaching to the converted, but I'd like to just take a few minutes this morning to bring you through, some of what we do as an organisation, in the hope that when you do meet patients, that you can at least tell them there is a patient organisation that's out there to support you, and they have a range of things, and at least if they know we're there, they can choose what level they want to engage at. So if they want to call our helpline, if they want to do one of our courses, it's up to them to choose whatever entry path they want to into the organisation. But they have to know, obviously, that we're there in the first place. So that's why I've called this Facing Arthritis Together, because we, the patient organisation, and you, the healthcare professionals, we're all working to improve the lives of people living with arthritis. So just in a nutshell, what we do can kind of be summarised in these four areas. So we have a very active research programme, which our ultimate lofty goal is to work on a cure. Its long-term goal is a cure for arthritis. I'm not going to talk about that today. We are all about fighting for better services as well. So, we know that the situation with rheumatology services has improved, I guess. Oliver mentioned I'm 13 and a half years in Arthritis Ireland, and I remember when I first started, we were always quoted as having the worst situation in the whole of Europe. I think it was one per 400,000 population. I can't remember, one rheumatologist per 400,000, I think it was at the time, and that was deemed to be the worst in Europe. I mean, we've improved, but we're still a way off. So Arthritis Ireland's role there is really to be putting pressure the whole time on government to improve services and to ensure that people get access to those services. We're also about creating better understanding. So we already heard some of the beliefs that people with arthritis and the general public have about arthritis. So, one of the things that Louise talked about was this whole thing that, well, if I exercise, it's going to cause me more pain. It'll increase my symptoms, or it could actually worsen my arthritis. So these are beliefs that we constantly meet people with, and I suppose part of what we do is, with the people themselves, is reinterpreting those beliefs, but also the general public around their beliefs around arthritis being just a few aches and pains that everybody will get if they live long enough. So we're all about that. And I suppose what I'd like to concentrate on today is just the whole role of Arthritis Ireland in helping people to take control of their disease. And that's where I suppose most of our services come into play. And I'm going to take most of the time to look at how we as an organisation empower people to live well with their arthritis. So we know that arthritis has many different symptoms, and it has a variety of impacts on a person's life, and you all see that in your daily work. And what we do is try to empower people to live the best quality of life that they possibly can. So, how do we do that? Well, for the last almost 12 years, we've been delivering what we call the self-management programme. It's a Living Well with Arthritis self-management programme. Many of you, I think, will already know about it, so apologies if I'm boring you to tears with information around it. But it's a 6-week course that we adopted from Stanford University in the States. It's a 6-week programme that runs in community settings. It's a licensed programme, so it's a licensed material that Stanford University developed through Professor Kate Lorig, and this programme is actually available all around the world. The beauty of that is that this programme has been the subject of a huge amount of research, so we do know that there's evidence to support the fact that it works. What it really is, in essence, is a meeting once a week for 2.5 hours where a maximum of 18 people living with all different types of arthritis come together, and they take part in a facilitated session led by 2 trained leaders, one or both of whom is living with arthritis themselves. And then, as I said, it's very important to us that it's delivered in community settings as well. So it's taking people out of their clinical setting and delivering this programme once a week in parish centres, schools, you name it, in a local area. It's always also about bringing it locally to people as well. So we run about between sort of 30 to 40 of them a year, 30 to 40 of these 6-week programs. And it's all about trying, over a number of years to get those courses out to people in communities. So we'd have a certain number running in Dublin. We nearly always have running here in Harold's Cross. But we'd also get out to the likes of, I think, Belmullet, I always use as an example because we had such a demand for courses there. We actually had to do 3 in a row. So you wouldn't necessarily think you'd get the population there, but people were just so eager to attend something that was on their doorstep. So what it does really is brings people together that are living with arthritis in a community setting, and it's really there to support and enhance the disease-specific education, but it doesn't replace it. So it's not a program of educating people about rheumatoid arthritis, osteoarthritis. It's about the principles involved, I suppose, in living with diseases like rheumatoid arthritis and osteoarthritis, etc. And it introduces people really to the tools needed in day-to-day life with chronic diseases. And I think this is really important because if you think about how often you maybe see your patients on an annual basis, what would you say, maybe a couple of hours over a year, maybe, if you're lucky? So the rest of that time, patients or people living with arthritis are living with it themselves. So it's really important that we equip them with skills to live well with their condition. So really what this course is all about, in essence, is improving the confidence of people. By improving the confidence in their ability to manage their disease, they'll have better outcomes. That's really what this programme is saying. And there's a lot of topics covered over the course of 6 weeks, and these are some of the key ones. So we encourage people to set, weekly goals, and I'm conscious of what Donal was saying there at the outset about, like, setting a goal is really important, isn't it? And it's setting an achievable goal is even more important. So what Donal was saying about weight loss, that people can sometimes set a very high goal, but if it's not achievable, then a person is just on a path to failure. So what we actually do here is help people to set realistic goals for themselves. Physical activity is a huge part of it, and many people, as I said, come with the belief that physical activity is going to cause them more pain, that it's bad for their arthritis. So we have to work on reinterpreting those beliefs for people and to, I suppose, start at a very ground level. And Louise mentioned that as well, about the importance of, the National Physical Activity Guidelines are out there, but many people with arthritis aren't anywhere near that. That doesn't mean it's not something we can aspire to, but it requires incremental change and a pathway to achieving that over time. The emotional side and the psychosocial effects of living with arthritis are covered throughout the programme as well. So we look at things like dealing with negative emotions, dealing with depression. So they're a really important part of the course as well. Relaxation techniques as well. Tips for eating well, we cover that as well, and a lot of it will be on message for what Donal O'Shea was saying here today as well, around a well-balanced, portion controlled diet, improving communications, and also medication responsibilities. So we don't actually go into the ins and outs of different medications, but what we look at, it's kind of on a different level. We look at the responsibilities that people with arthritis have as regards to taking their medications, how they take them, how they remember to take them, how they report other potential medications that they might be taking that are not over the counter, etc. And I suppose a big part of it is effective problem solving. And I'm looking at my co-trainer Claire there in the front row. Like, we always say, this is the most beneficial part of the whole programme, because everybody's life is strewn with obstacles, but for somebody living with arthritis, the path can be more populated with obstacles. And if we can help people to, develop effective problem-solving skills, then we're making life a little bit easier for people living with arthritis. So that's really a really important part of the course. Just wanted to talk about, it's all very well, all of that sounds great, I'm sure. We did do a 3-year evaluation of the programme a few years ago. So there was lots of international research carried out, but the question was being asked, well, I wonder are the results going to be the same in Ireland as they have been elsewhere in the world? And this is just a summary of it. So we did a 3-year evaluation, which we undertook with the University of Ottawa in Canada, And you can see the results there, that people did improve their ability to cope with pain. They became more active themselves in managing their arthritis. They did increase their amount of regular exercise. They improved their attitude towards living with their condition. They also increased their knowledge of their condition. And they did reduce their visits to hospital and their reliance on GPs. So there's very powerful statements there within that summarise the research that we conducted. And I always point back to, you take that research and say, well, what does that actually mean? And Claire and I delivered one of our first courses out in Tala nearly 12 years ago. And one of the questions we asked the group, this is part of the course all the time, you ask the person, what does it mean, to have, in this instance it was, what does it mean to have arthritis? So you asked that question in week 1, and this is what the group fed back. So they fed back things like, it means intense pain, an inability to do things, it stops me doing a lot of things, I'm not being able to do physical work, it doesn't badly affect me, but I'm always scared, I'm too young to have it and I don't want it. It's a nuisance, it's a curse. So I think when you look at that, it's very negative, isn't it? And I suppose that might be what you'd expect to when you ask people, what does it mean to have arthritis? So that's in week 1. And then this group and these individuals went through a 6-week program. And at the end, we asked them the same question. In closing the course on week 6, we asked them the same question. Well, what does it mean to have arthritis? So you can see this is what the exact same group fed back after 6 weeks. So things like self-management improves my health. I can help myself from day to day. I have positive views on dieting and exercises and relaxation. It's less debilitating and more manageable than I realised. It's a painful condition you can learn to live with and grow through it. So if you see, there's a lot more positivity. And I think that's one of the things I have certainly seen, and my other co-facilitators have seen as well. It's the transformation that can happen in people over 6 weeks, from believing that maybe their life has changed, beyond recognition, to kind of saying, well, yes, I have arthritis, but actually it doesn't define who I am. It doesn't have to define who I am. And there are ways that I can play an active role in managing it. So I'm just going to, am I okay for time, or am I, playing you a little video.
Self-management to me means taking control back of your life.
Self-management for me is waking up in the morning and realising that nobody's going to do anything about the way I feel except myself.
Self-management for me is the most important thing about living with arthritis. I'm living with it 24 hours a day, 7 days a week, something that my doctors, my rheumatologists, they only see me on rare occasions. I'm the one that has to do it day in, day out.
At Arthritis Ireland, we have 3 types of self-management courses on offer. Firstly, we have Living Well with Arthritis, a 6-week community-based programme available in locations all around the country. Secondly, we have Breaking the Pain Cycle, which is a half-day workshop, again delivered in the community and available all around Ireland. Thirdly, we have Living Well with Arthritis Online, an online education programme which you can complete in the comfort of your own home over a number of hours. Here is what some people had to say about our courses.
All of the things that I wasn't told in a doctor's surgery, I was told on the self-management course, and they're the things that are with me every day.
Practically, it helped me by learning pain management techniques like distraction and meditation, things that I had never heard of.
Taught me how to set a goal each week, like modest goals, and to keep at that.
I found that there were other people with the condition, so I didn't feel so alone.
I realised how important it is to carry on and do as much as possible, and how that can actually improve my symptoms and make me feel better.
You got to meet people in similar situations to yourself.
I think the big thing I learned from was to be active.
I had a better knowledge of my disease and I had a better knowledge of how to help myself.
If you're thinking of doing the course, the first thing I'd say is do it. It makes such a massive difference to the whole outlook on living with arthritis.
I would recommend the course to other people definitely who have any form of arthritis or fibromyalgia, because I don't know, to me it just opened up a new life for me.
If any younger person was looking to do a course like that, I'd highly recommend it.
I had very bad thoughts about how my life was going to turn out, and the course, like, to be honest, really saved me.
For more information on all our self-management courses, log on to arthritisireland.ie, or you can call our helpline on 1890 252 846.
So I think all of those people who kindly participated in that video, they put it a lot more eloquently than I could ever put it. So I think just what I would like to ask of you is, please do refer patients that you're dealing with to us, and hopefully they can avail of that truly, transformational program. For people who you meet that maybe aren't going into a classroom in a community setting isn't for them, and people like to learn in different ways. We also have an online version of the program now as well, which we've developed over the last couple of years. So a lot of the same messaging is there, so people can, if they either can't, come of an evening or an afternoon to a course, they prefer not to be in a group setting, they prefer to do it in their own home. We have an online version as well, so that's just to let you know. Just a couple of words on other things that we have. Obviously, stage one, often when a person is diagnosed, is getting information. So we have a wealth of information in Arthritis Ireland. So we have information booklets that are available in hard copy for order. We do prioritise rheumatology clinics. We've had to in the past few years for budgetary reasons, so we're at the moment we're not really able to send them out to primary care, but we can to rheumatology centres. It's literally a funding issue with these booklets. Everybody wants to fund them the first year, and then it's very hard to get the funding for the second and third year and so on, but they are all available on our website. So I think many people are moving to that form of getting their information anyway. We also have some drug information leaflets, so we have a lot of the all of the therapy areas for inflammatory arthritis. We have kind of patient-friendly drug information leaflets on those medications, and all available obviously on our website. So information, is there to help people and enlighten them. We also have a helpline, and just a word about our helpline. The helpline is primarily there for practical information, emotional support. I know I've been asked in the past when I've done kind of talks to healthcare professional audiences, well, do we give advice? We don't give medical advice of any sort. The helpline is manned by people who are all living with arthritis themselves, who've been specifically trained and selected for those roles. What I will say is that where I know some of the rheumatology units in particular have worked with us to look at kind of referral into the helpline, it has really worked in that I know some of you where you might have, say, a nurse line in the hospital tends to get, once that nurse line number gets out there, tends to get really, really busy. And I know one hospital in particular that I spoke to about this. We are there as a kind of, if you like, that second layer of support where people might need maybe some time to discuss more issues of emotional nature that can be very, very time consuming in a clinical setting. So please do use us, So the number is there on that slide. And, just to back up what Louise was saying, physical activity in Arthritis Ireland, we believe movement is the best medicine. So for us, what we constantly raise awareness about it, when people are looking for that magic bullet that's going to help them with their arthritis, that's sort of it. Physical activity is the nearest thing you can get to a magic bullet. So with that in mind, over the last number of years, we've developed a whole range of physical activity initiatives for people living with arthritis, from walking groups, from DVDs and books that people can follow at home, to chartered physiotherapist-led water and land-based programs. So we have a lot of things that can help people to, start that process of getting physically active. And we're also about helping children and teenagers with arthritis as well. So we have a range of mainly information supports really around that. And our big thing would be advocating for a third paediatric rheumatologist. So that would be a focus area. And we have a branch network as well, just so that people know we're not, even though our office is based in Dublin, we actually have a networks all around the country as well. Okay, thank you very much.